Hey, it's Raj from 3CB Performance. Philadelphia 76ers superstar and franchise cornerpiece Ben Simmons is dealing with, quote, lumbar, low back, nerve impingement, as reported first by Shams Charania, and is set to be reevaluated by the Sixers medical staff in 2 weeks. In this video, I'll explain what lumbar nerve impingement is, potential root causes, and how that informs Ben's treatment and return timeline. The spine is made up of bones called vertebrae that are stacked on top of each other and designated by region and descending order. For example, L4 refers to the fourth vertebrae in the lumbar low back spine. Between these vertebrae sit shock-absorbing discs known as, quote, intervertebral discs. Think of these discs like jelly donuts, a tough, elastic exterior, aka the annulus fibrosus, that encapsulates a soft, jelly-like interior, the nucleus pulposus. The spinal nerves travel downwards through the spinal canal between the posterior, backside, and anterior, front-side column of the vertebrae and exit at each level through the, quote, intervertebral foramen, aka an opening between the bones, to the periphery, arms, legs, etc. Lumbar nerve impingement means that a nerve in the low back section is getting irritated, which can manifest as shooting, burning, numbness, tingling, and muscle tightness and or weakness in the lower back and down the leg. The farther the discomfort travels, the more serious the issue. In young athletes like Simmons who develop lumbar nerve impingement, it typically means the impingement is of the, quote, nerve root, which lies near the intervertebral foramen. What we know right now is that Ben will be undergoing treatment and rehab for the next 2 weeks and then reevaluated. It also wouldn't surprise me if Ben is getting an epidural injection to calm down the ongoing inflammation or a specific nerve block to reduce nerve symptoms. Further, according to Woj, that 2-week timeline is more of a benchmark date rather than an expectation that he'll be back at that point. If Simmons isn't showing enough progress with symptom reduction and improved functionality in 2 weeks, then the medical staff has to determine the root cause, which will dictate the appropriate next steps. To that point, let's go through the 2 most common root causes of lumbar nerve root impingement in young athletes and how that informs treatment and return to play RTP timeline. A disc herniation is when the interior substance of the disc, nucleus pulposus, leaks out through a crack in the exterior annulus fibrosus and irritates the nerve. In young athletes, that crack in the annulus is typically the result of acute contact, like an awkward fall, twist, or hit. If the first line of treatment, physio, which the research shows helps about 90% of patients, and second line of treatment, epidural or nerve block injections fail to show benefits, or there's progressive worsening of symptoms over a 6-week period, then surgery can be indicated. The surgical procedure is commonly a, quote, microdiscectomy, in which the surgeon removes the leaking disc substance and repairs the exterior crack. The return to play for elite athletes following a microdiscectomy is on average around 3 months, with research on NBA players indicating similar post and pre-injury performance levels with no significant difference in career longevity. Further, the outcomes tend to be even better in younger athletes like Simmons. A stress fracture in the lumbar vertebrae, most commonly in the region known as the, quote, pars interarticularis, which is termed a spondylolysis, isn't uncommon in younger athletes, especially in sports that involve a lot of trunk extension and rotation, particularly against resistance like in basketball. This stress fracture is often not symptomatic, but can eventually manifest as localized back pain and inflammation from the fracture, which can irritate the nerve. Further, roughly 15% of spondylolysis cases progress to what's known as a spondylolisthesis, which is when one vertebral segment translates forwards over the one beneath it, often resulting in progressive and more severe nerve symptoms. The first line of defense is again physio, and if that fails, TLSO bracing for upwards of 3 months. If this non-operative management fails, then the next line is surgery. In young athletes, the most common surgery is a quote, pars interarticularis repair, with evidence increasingly showing very good outcomes when combined with appropriate post-surgery rehab, with athletes returning to play at an average of 4 to 6 months and eventually hitting their pre-injury performance levels. In Ben's case, an elite professional athlete on a season timeline, whether for this season or returning for the start of next season, many of the typical decision-making timelines will be condensed. I imagine if he's not showing progress early on, then the team will move quickly to more aggressive means rather than waiting the 6+ weeks of conservative therapy or bracing that's indicated. The key takeaway here is that this is a really fluid situation with significant gray area. That's often the reality with lumbar pain and impingement cases, as you want to see if the injury and symptoms stabilize or evolve over time with conservative means before proceeding to more invasive means. Therefore, the key inflection point will be at the 2-week reevaluation, where the Sixers medical staff will determine if there's enough improvement to warrant continuing on the same path, or if a more aggressive detour is required. It's not what anyone likes to hear. This is truly a wait-and-see scenario. That being said, even in the potential worst-case scenario that Simmons needs surgery, I'd still anticipate him being ready to go for Sixers training camp in September. That's a wrap for this video. Thanks for watching. My goal is to provide you with in-depth, evidence-based, narrative-free analysis, and you can always find me on IG and Twitter at 3CB Performance. Make sure to sub to the channel and follow along on all social media for the latest updates. 3CB out.